Okay, so just carrying on from last video, this is just going to look a little bit more closely at actually what's in this kit. The first section we'll look at is the equipment section. So this section here, which obviously I'll pull out. As I said before, I did really tend to pull it out normally. This is pretty much just general equipment I use to look in throats and ears and that type of thing. A stethoscope. This kind of died on the trip. This is an old stethoscope. I actually normally use a cardiology stethoscope, which has got a double-sided pediatric and adult bell on it. This one died in the heat, and all of the rubber around the diaphragm disintegrated. So I kind of tried to put it back together, but I'll need to order a new diaphragm for this. It actually needs a new tubing as well, so maybe it'll get retired. I just had a single Goodell's in there. As I said, we only had really adults with us, and I didn't have spare room in this pack for lots of different size Goodell's, and this combined with the face mask was probably enough, and also with newer resuscitation recommendations, with airway being a lower priority than circulation. I just went with the one. I had a little torch in there. This is just really a backup torch because I've got a big torch in the bag, as I showed you earlier. I had a knife in there. Again, probably more for emergency sort of situations where needed to do something quickly to come to someone's assistance requiring a knife. I didn't want to be without one. It's also a nice sharp blade, this one. I didn't know about what the laws were in the country where we were travelling with this big pack. In Australia, you are not allowed to carry a pocket knife unless you have a lawful excuse to do so. In New South Wales anyway. I guess as part of a set of equipment for first aid or emergency medical assistance, that would be considered a lawful excuse, but I don't know that that's been tested legally, so just be aware of that. If you carry a knife in Australia, you need to just check the laws, or wherever you are. I had a little screwdriver set. I actually use this a fair bit. There was lots of situations where we had sunglasses or glasses that needed repairs, and it's just a little one I bought from a little Japanese shop, and that came in quite handy. Sorry if you can hear my children screaming in the background. I had a thermometer and some little probe covers. I'm not a big advocate of frequently taking temperatures. More used it to reassure that the temperature was normal rather than to see if people were hot. You can normally tell by looking at people or feeling them that they've got a temperature. I just had a little small otoscope in here. This is a Welsh Allen one. Actually, I should take the batteries out of it to store it. I've had these Welsh Allen ones in the past and forgotten to take the batteries out when it's stored, and they've corroded and destroyed the whole thing. Welsh Allen did repair it, but it was quite expensive to get it repaired, and just some spare little covers to put on them. Glucometer, blood sugar machine, with some little soft click lancets. I used this on the trip probably 3 or 4 times. We had 2 type 1 diabetics in the big group, and they were actually fine. We also had several type 2 diabetics, and then I tend to find a bit more of a problem with low blood sugars, especially on a long trip where it's hot and there's lots of activity involved. I took the instructions with this one with me. It's not one that I'm particularly familiar with. I did try it out a few times on myself before we left, but it's different to the one that we use in the hospitals that I work. Sphygmomanometer. This is an old sphygmomanometer, and gee, it's fantastic. Don't know what brand it is. I've had this for a long time. It's actually got my maiden name on it, so I've been married for 17 years, so it's a pretty old sphygmomanometer, and it's still standing up good. There's a few bits and pieces in there. There's some spare forceps, scissors, a couple of pairs of tweezers, and some safety pins. This is a drug dosing guide. It's the Frank Shamrock. This is an old one from 2013. It expired. I actually have this on my phone now. I like having a backup. To be honest, so all the medication that I took with me, I know the dosing of it. So I generally wouldn't need to look anything up. I guess it's more if people have their own medication with me and I'm not sure about dosing of that, maybe that might be helpful, but wasn't something I used. Got a couple of tongue depressors. I actually had a lot more of them in here, and a urine drug kit, which you can buy from chemists in Australia. Thank goodness, didn't need that. And a urine pregnancy kit, and a couple of small plastic bags. And that was all I had in the equipment section. So if you'd like to see more, give me a like, and go through the rest of the packs in following times. Thanks for joining me for this, and talk to you soon.